TOPSE2 most common summer diseases and how to prevent them. Everyone loves and enjoys summer days, especially our children who just love to go out and play, since this is also their vacation, break away from school. However, summer is also a time for some seasonal diseases, so we need to take care of ourselves and of our children. Hey, prevention is better than cure, and we just can't let these diseases destroy our summer fun, right? Well, below are the top 10 common diseases during summer and how to avoid them. 1. Sunburn. With lots of tropical sunshine during this season, sunburn is rampant. This is a radiation burn that affects the skin with too much exposure to the UV ultraviolet rays from the sun. Common symptoms include reddish skin that is hot to touch, painful, general fatigue, and mild dizziness. To avoid this, outdoor activities must be done early in the morning or late afternoon to avoid overexposure in the hottest part of the day, between about 10 a.m. to 3 p.m., and avoid staying outside for too long. Drink 8 to 12 glasses of water a day. Most important, use sunscreen products before going outside. A rating of 30 or above is best. Refresh every few hours and especially after swimming. 2. Flu and cough. Flu is an extremely contagious respiratory illness caused by influenza or B viruses, and cough can be caused by any of several upper airway problems, especially infections or related to polluted air. Asthma also has a variant that presents as a cough in children. Symptoms of flu include fever, headache, and muscle soreness. These symptoms can be at least partly relieved by drinking 8 glasses of water daily, but avoid drinking too much cold water. It is advisable for those who are feeling sick to stay home and to always cover the nose and mouth when coughing or sneezing. 3. Sore eyes. The unpleasant sensation in or around one or both eyes can be due to toxic air or sometimes pink eye conjunctivitis, viral infection. Your eyes may feel gritty, tender, or tired when eyes are itchy due to dirt or allergies. Excessive rubbing can make the problem worse. Eye drops may be helpful, but be sure to use artificial tears or the red out type only. Also, washing hands is advisable to avoid spreading the virus in the case of pink eye. 4. Skin diseases. Skin disease is the breakdown of a cell layer in the epidermis and thickening of the prickle cell layer. This can include dark, wart-like patches in the body folds, eczema, skin rashes, hives, warts, and vitiligo. Skin diseases abound when water becomes scarce and daily bathing compromised. Water isn't clean like in and maintained swimming pools, or due to heat and congestion. This can be prevented with proper hygiene, taking a bath after plunging in the pool, bathing daily with clean water, and less exposure to direct sun. 5. Rabies. Since it is summer and kids go to different places to bond with their friends, there is a possibility that they can encounter dogs and other animals along the way. If kids are bitten, it is important to check the status of the dog through the owner. If unknown or from a wild or feral animal, rabies precautions should be given. Although rarely a problem in the cities, more rural areas do have rabid dogs and other animals. Because the chance of rabies in the cities is so rare, we do not recommend routine vaccination. However, if bitten, the vaccinations should be given as soon as possible. 6. Stomach ailments. Vomiting and diarrhea follow after consuming contaminated food or drinks. Street foods, especially, require caution. Also, those foods prepared for trips should be kept cold or eaten promptly. Always remember that during summer, food spoils faster because of the temperature. To avoid this, eat healthy, fresh, and nutritious foods. We have to put this into our minds that a healthy lifestyle not only changes your body, it changes your mind, your attitude, and your mood. Be safe, everyone, in spending your summer vacation. 7. Food poisoning arises when people eat foods in which bacteria have grown due to improper cooking or refrigeration. This tends to happen more frequently in outdoor settings that lack kitchen appliances. For instance, at a picnic or on the hiking trail, people may get sick from the bacteria itself, as with salmonella, or from a toxin made by the bacteria, which is how botulism develops. Warm weather activities and conditions may also contribute to enterovirus infections, but it's still a mystery why the incidence of this large and very common family of viruses spread through respiratory droplets or digestive secretions surges in summer months. The trend with a variety of enteroviruses in the summer is similar to what we're used to with the flu, which is more frequent in the winter, Dr. Krieger said. Top 3 tips for preventing infectious diseases this summer. Short of avoiding all outdoor activities, it's impossible to completely prevent exposure to summer's top infectious diseases. But there are preventive measures that can help. Avoid getting mosquito and tick bites. In addition to applying insect repellent, you can lower your risk of bites by wearing long pants and long sleeves outdoors. To avoid mosquito bites, avoid time outdoors at night. To avoid tick bites, tuck the bottom of your pants into your shoes or socks while outside, and inspect your body after you've returned home. Ticks are small, and their bites are painless, so it's easy to overlook them, Dr. Krieger said. It's a good idea to have someone help you check for ticks. You can't see the top of your head, but ticks often attach there. Ensure proper refrigeration and cooking. If you're at a picnic or campsite, don't eat anything that has been sitting out a while or has been in the refrigerator too long before the outing, Dr. Krieger said. Reheating foods to a high enough temperature can help, as most bacteria are killed by heat. However, some toxins are not. Practice good hygiene. At ID Care, we recommend that our patients follow the hygiene rules their mothers taught them. Stay away from people who seem to be sick with any illness and wash your hands well and often, Dr. Krieger said. This can help prevent not only enteroviruses but food poisoning. In addition, we've learned some things from the COVID-19 pandemic. Wherever people are gathered, distancing and wearing a mask can help prevent the transmission of viruses.